A screw is going into bone the width of your finger. A few millimeters one way is the spinal cord. A few millimeters the other way, the nerve that lifts a foot. Your hands are calm. You have placed thousands of these. Nobody warned you which part of this job would cost the most. It is not the screw, and it is not the fear. It is the weight across your shoulders while you work, and what it is quietly doing to the spine inside your own neck. You fix spines for a living, and you are slowly wearing out your own. 14 years ago, you had never touched a patient. Level 1. Medical student. You are a fourth-year medical student. You are nothing, and you owe around $200,000. For 2 years, you have been auditioning, away rotations at hospitals that aren't yours, a month at a stretch, arriving before anyone else, scrubbing into cases on a team that will forget your name by August. Every day is a tryout. You get there first and leave last, and you make sure the resident who barely knows you has nothing bad to write, because they're writing something and it counts. In the gaps you build research, posters, abstracts, papers, nobody outside the field will ever open. Stacked up because everyone applying has them, so you need them too. Some students add a whole extra year just for this, a research year. More time, more debt, all of it spent making yourself the kind of applicant who might get in. Because orthopedic surgery is one of the hardest doors in medicine to walk through. In a recent year, only about 62% of applicants matched. The ones who did had a median Step 2 score of 256, well above the line for almost everything else. This is also where the path forks, though you can't see it yet. Spines get fixed by two kinds of surgeons, the orthopedic ones and the neurosurgical ones. And the bet on which you'll be is being placed right now, years before you ever stand over a spine. You chose orthopedics, 5 years of training built around bone and hardware and the mechanics of how a body holds itself up. The other door led to 7 years built around the brain and the nerves. Both end at the same operating table. You'll only ever walk through one of them. Then comes a morning in March. The whole thing, the decade, the debt, the auditions, comes down to one email that either has your name in a program or doesn't. Yours does. You don't know yet that getting in was the easy part. You matched. Now you're the most junior person in the building. Level 2, intern. First-year resident, about $64,000 a year. You have a medical degree. In the operating room, you hold a retractor and you close skin after everyone more important has left. That's the year. Pre-rounds in the dark before 6, the patient list folded in your coat, the pager going off in the middle of a stitch. Half of intern year, you aren't even on your own service. You rotate through general surgery, through the emergency department, through nights on the medicine floor, paying dues in specialties you'll never practice, because that's how the first year is built. And when you finally are on orthopedics, the work is splints and casts and reducing a broken wrist in the emergency room at 3 in the morning, the pager buzzing for the next fracture before you finish the last one. The operating you came for is still up ahead, out of reach. The first spine case you scrub, you stand for 3 hours holding a piece of metal that keeps the wound open. Hold this. Don't move. So you don't move, your hand goes numb, and you watch the attending work from a foot away and understand how little you actually know. He doesn't know your name. He will, eventually, not this year. Run the math on the paycheck and it stings. $64,000 sounds like real money, until you spread it across 80-hour weeks. Then it's close to what the person parking your car makes by the hour. And the whole time, $200,000 in loans sits in the background, quietly getting larger. Somewhere in the middle of all this, you sit Step 3, the last of the licensing exams, studying for it on the train, and in the on-call room because there is nowhere else left in the day to put it. At dinner, saying you're an orthopedic surgery resident sounds impressive. At work, it mostly means you're the one who answers the page. Then, somewhere in your second year, someone hands you the drill. Level 3, senior resident. You're a senior resident now, somewhere in years 2 through 5. The paycheck has crept from the high 60s toward $80,000, which barely registers against what changed. Now you're the one operating. The intern holds the retractor. The pager goes off at 2 in the morning for a trauma, and the operating room is yours to run. A broken body on the table, a fracture to fix, the night staff watching you decide. Then there's the case you'll remember for the rest of your life. Mid-fusion, the attending steps back from the table, pulls off his gloves and says, "Finish it." And you do. The room is quiet, the hands moving are yours, and for the first time, someone with everything to lose decided to trust you with it. The last 2 years of this happen in a single program by rule, so the people teaching you have watched you grow up, and they hand you more every month. Somewhere in here, you start studying for your written boards in the cracks between cases. A textbook, open on the break room table at 1 in the morning. And these 5 years aren't only spine. You set broken hips, you scope knees, you pin shattered wrists, you rebuild shoulders. Orthopedics is the whole skeleton, and you train on all of it. But the spine cases are the ones you stay late for. This is the year the apron goes on, 15 pounds of radiation shielding draped over your shoulders, worn for hours at a time, because the live x-ray machine you stand beside in spine work throws off a field you can't see. Spine surgery can hit a surgeon with up to 12 times the radiation of other procedures, so you wear the weight. Everyone does. What nobody mentions is that this is where the damage starts. In your neck, in your lower back, and you won't feel the worst of it for years. You don't know yet that the apron you just put on you will almost never take off again. 5 years in, you choose. One part of the body for the rest of your career. Level 4, Spine Fellow. 90,000, maybe 110. You are 32 years old. For 1 year, you do nothing but spine. Necks, mid-backs, lower backs, worn-out discs, and twisted curves. You come in before 6:30 for cases that run back to back, you read scans between them, and your phone fills up with the attending's texts about tomorrow's list. And the surgeon, scrubbed in next to you, came up through neurosurgery, not orthopedics. The two paths that split back at the match, finally standing at the same table, learning the same operation from opposite directions. You spent a decade thinking of them as the other tribe. Now you're handing each other instruments. You place a pedicle screw with the attending's hand near yours but not on yours, and the difference between near and on is everything. Then one afternoon, the monitoring changes. There are leads on the patient tracking the signal running down the spinal cord, and the number on the screen drops, and the whole room goes still in a way no one has to explain. Everyone knows what that quiet means. The margin you are working inside, the space between fixing someone and ruining them, is about the width of a few millimeters. This is the year the operations stop being abstractions. You learn to take pressure off a nerve that's been pinched for years, to clear out a worn disc and lock the bones above and below it into one, to read a curve on a film and know exactly where the first screw goes. The hands are getting good. That's the year you understand the real cost of this job. Not the money, though the money stings too. Another 12 months at resident pay, while the friends you went to college with own homes and have children in school. The real cost is what you now carry into every operation. A slip of a hand, a screw a little too far, and a person who walked in walks out in a wheelchair. That stays with you for good. Then the attending walks out of the room and doesn't come back. The room is yours. Level 5 Junior Attending. Junior attending somewhere between $500,000 and $700,000 a year, and not yet board certified. The number is staggering after 14 years of owing instead of earning. It also comes with a silence you weren't ready for. Nobody scrubs out anymore because there is nobody above you to scrub out. You build a practice from nothing. No referrals, no reputation, a calendar you have to fill one patient at a time. You introduce yourself to primary care doctors who have never heard of you, and you spend hours on the phone fighting insurance companies that keep denying the operation your patient needs. And here is the part nobody warns you about. Every operation you perform in roughly your first year and a half becomes the list of cases the board will examine you on. Your earliest work, the cases you did with the least experience and the least help, gets handed back to you across a table. 2 examiners pick 12 of them and question every decision you made across 4 sessions, the oral boards. You pass them on the strength of the hardest year of your career. So you operate, and then you don't sleep. The night after a big fusion, you lie awake, refreshing the monitor on your phone, and at 2 in the morning, you call the floor and ask the nurse one question. Can the patient move both legs? The answer is yes. You still don't sleep. Then comes your first real complication, and it is yours alone. A wound that won't close. A screw that has to come back out. A patient who calls the office angry and frightened. There is no attending to hand it to anymore. You sit down with the family, you tell them exactly what happened, and you go back in and fix it yourself. And then there's the part of the job nobody prepares you for, getting sued. Roughly 1 in 7 orthopedic surgeons get sued in a given year, against about 7 out of 100 doctors overall. And spine draws some of the biggest claims in surgery. When a spine case goes wrong, it can go wrong in a way that lasts a lifetime. Every consent form you sign, you feel it. 2 cases are coming, though you can't see them yet. The one that terrifies you will go fine. The one that ends in a courtroom will look completely routine on paper. You pass your boards, and you start turning down operations you once would have taken. Level 6, Established Surgeon. Board certified, established, fully yourself in the operating room. The median is somewhere from 700,000 into 7 figures, and the surgeons at the very top of this level, the ones who fix the worst spines, are among the highest earners in all of medicine. Here the road splits one more time. Most of the work is bread and butter. Pinched nerves, worn discs, short fusions, high volume, people who walk in hurting and walk out better. Or you turn toward the hardest version of the job. Deformity, scoliosis. The spine's so twisted that other surgeons say no, and the revisions of operations that other surgeons already failed. Picture that harder road. A 10-hour case, the monitoring running the entire time, a spine curved 60 degrees that you are straightening one segment at a time. And there's a moment near the end when the rods seat and the curve comes out of the spine under your hands. Weeks later, that teenager is standing in your clinic, taller than they have ever been, still sore, still healing, but straight. After everything this job takes, that is the part it gives back. By now, you can operate. The harder part is knowing when not to. The hardest thing you do all week isn't an operation. It's looking at a patient who wants surgery and telling them no, because you can see it won't help, and watching them get angry and leave to find someone who'll say yes. By now, your own neck hurts most weeks, and it doesn't really stop. You're not alone in it. 2 out of 3 spine surgeons report neck pain in the past year, and more than half say it limits what they can do. Almost none of them cut back. So you stand at the table straightening someone else's spine while your own wears down under the apron you've had on for 15 years. And the radiation you can't see kept adding up the whole time. In one survey of orthopedic surgeons, nearly 1 in 6 said they'd been diagnosed with cancer. You knew. You wore the shielding. You stood in the field anyway, thousands of hours, because that's where the work is. Operate long enough, and one day they stop asking you to operate. Level 7. Top of the field. Chief of the division, chair of the department, the surgeon other surgeons fly their hardest cases to, and the name on the committees that decide where the whole field goes next. More than $1 million and a kind of power that the money doesn't measure. You run the place now. The job is hiring surgeons, defending the department's budget, sitting in meetings that have nothing to do with the patient. You train the fellows. At a national meeting, you stand at the front and present the numbers that settle an argument for the whole room. Which robot, which implant, which way to do the operation that thousands of surgeons will copy. One day, a fellow you trained straightens a deformed spine on their own, start to finish, while your hands stay folded in your lap. You taught those hands. It would be faster to step in and do it yourself. You let them learn instead. The certification you earned at level 6 never actually ended either. There's a maintenance requirement that follows you the whole way up. Courses, exams, evidence that the surgeon at the top of the field is still keeping current. So even now, decades in, a part of every year goes to proving you still belong here. You operate on fewer days than you used to. Part of that is the job. The institution needs you in meetings more than at the table. And part of it is the neck you ignored for 25 years, which has finally decided it won't let you stand bent over a spine for 10 hours straight. So you teach the younger surgeons the radiation habits and the posture and the ergonomics that nobody ever taught you, back when the apron first went on. By now, the risks aren't abstract. You know the surgeon who stopped operating when his neck finally gave out. You know one who got cancer. Nobody says out loud that the job did it, but everyone in the room has done the math. Somewhere down the hall, a fourth-year student is on an away rotation, arriving before everyone, hoping someone important notices. They have never touched a spine. The student watches you scrub out of a case. They see the steady hands, the title on the door, the number everyone whispers about. They don't see the apron or the count of hours you've stood inside an invisible field, or the nights spent refreshing a monitor to find out whether a stranger could still move both legs. They don't see that the millimeter cuts both ways. It costs the patient when you miss it, and it has cost you something every time you didn't. They only see the top, so they start auditioning the way you did, certain the hard part is getting in. It isn't. The apron, the millimeters, the years bent over a table. None of that shows in the part they can see. In a few years, someone will hand them an apron of their own. They'll put it on without thinking twice.